Welcome. Welcome to this session of coagulant and anticoagulant. You have heard this terminology so many times. Our blood, which is in our body, it contains a number of coagulant factors and anticoagulant factors. When our blood vessels or any injury happens, the coagulation takes place. Sometimes this coagulation becomes hypercoagulation. In those cases, we use anticoagulants. We have our body system, natural system of coagulation and anticoagulation. But there are a number of drugs which are used as an anticoagulant. Today, we are going to discuss these coagulant and anticoagulant with the more emphasis on the anticoagulants. I am Dr. Ahmed Nawaz Khan from School of Pharmacy. So before we start what are the coagulants and anticoagulants, first we should know that what is hemostasis. We know that in our body we have blood, and that blood circulates throughout the body. This blood, which is part of the connective tissues, it balances between the thrombosis and the hemorrhage. It also maintains the hemostasis. What is hemorrhage? Hemorrhage is the bleeding. It is used to describe the blood loss. It can be happens inside the body, that is known as internal bleeding. It can happen outside the body, that is external bleeding. So this bleeding is known as the hemorrhage. The thrombosis is the process of the blood clotting, which is known as the thrombus. That means which forming in a blood vessels. So the blood function as a balancing between the hemorrhage and the thrombosis. So we have now the next is the hemostasis. This is the process to prevent and stop bleeding. Prevent and stop bleeding, meaning that keeping our blood within a damaged blood vessels for long period of time. Now the opposite of this hemostasis is the hemorrhage. The first stage in this process is the wound healing. So this involves the coagulation. This involves the coagulation, blood changing from a liquid to the gel form. Now you can see that this is the major component of the hemostasis. They are like the vasoconstriction, which is the narrowing of the blood vessels. Then primary hemostasis, secondary hemostasis, and tertiary hemostasis. Which these factors, they are number of factors are playing very important role. So what actually is happening that this hemostasis is facilitating a series of enzymatic activations that lead to the formation of a clot with the platelet and the fibrin polymer. You can see in this diagram that it is the platelet plug is formed, and with the fibrin the blood clots. So the blood clot may become the blood develops with the platelet and the fibrin polymers. This clot actually seals the area which is injured, and that controls and prevent the further bleeding. And while the tissues, they start their regeneration process. So once the injury start to heal, this plug or the clot slowly remodels and it dissolves within the restoration of the normal tissues where the damage or the injury took place. When an injury causes a blood vessel wall to break, some of the platelets, they become activated. They change shape from the round to spiny or some sticky to broken vessels wall and begin to plug the break where the injury has taken place. These also interact with the blood protein to form a clot that actually plug the break where there is injury is taken place. This is of primary hemostasis. That means the platelet factor play a very important role in the primary. In the secondary hemostasis, blood clotting factors play important roles. There is one more, which is the tertiary. It is actually the clot resolution. It is clot resolution. So in the first, that is the narrowing or the constriction of the blood vessels, the vasoconstriction occurs. In the primary hemostasis, some kind of activity of cell-like blood particles, they help in blood clotting, that is known as the platelets. In the secondary, activity of some protein found in the blood that work with the platelet to help the blood clot. These proteins which are found in the blood, which help in the blood clot, they are known as clotting factors. The tertiary hemostasis, it is the clot attract and stimulate the growth of the fibroblast and the smooth muscle cells within the blood vessel wall, and they begin repair process which ultimately result in the dissolution of the clot, and this dissolution of the clot is known as the fibrinolysis. Now come to the next point, that is, what are this disorder of the hemostasis? We understand that what is the hemostasis, but what are the disorder of the hemostasis? So there are three main disorder of the hemostasis. One is hypercoagulation, hypocoagulation, and iatrogenic coagulopathy. Because of this, we use the anticoagulants. Now let's discuss and understand that what is the meaning of coagulant and anticoagulants. Because of the hemostasis problems or conditions, we are using the coagulants and anticoagulants. So coagulant is an agent that produces the coagulation. Coagulation is basically a complex process by which the blood forms the clot. While the anticoagulant also is a substance that prevents the coagulation and it stops blood from the clotting. Now, what are the factors which are responsible for the coagulation? So, there are number of factors, more than 20 of the factors they are known. They are known as the clotting factor or the coagulation factors. So the first factor 1, is the fibrinogen. Second factor is prothrombin, some tissue factor, calcium, proacelarin, acelarin, stable factor, antihemophilic factors, Christmas factors, Stuart-Powers factor, plasma thromboplastin antecedents, Hedgeman factor, fibrin stabilizing factor, and so many others. Now the next is the anticoagulant factors. So there are number of anticoagulant factors, and the first example is the PGI-1. What is this PGI-1? This is the prostacyclin, which is a prostaglandin membrane of the eicosanoid family of the lipid. Actually, this PGI, it inhibits the platelet activation and also an effective vasodilator. So this is also known as epoprostenol when it is used as a drug. Antithrombin, and next is protein C. This is also one of the factor, which is the 19th factor. 19th factor. This is protein C, also known as the zymogen. The TFPI factor, which is tissue factor pathway inhibitor, heparin, and fibrinolytic systems. So these are some of the factors which are involved in the coagulation and anticoagulations. So these anticoagulant drugs basically they inhibit either the action of the coagulation factor, just like heparin, or they interfere with the synthesis of the coagulation factor, just like the warfarin. So two options are there for the anticoagulant drugs. They inhibit either the action of the coagulation factor, the action which the coagulation factor shows, just like heparin, or it interfere with the synthesis of the coagulation factors, just like warfarins. So these heparin and warfarin, they works as an anticoagulant, and just like heparin for the inhibit the action of the coagulation, and warfarin for the synthesis of the coagulation factor. Now the next is these anticoagulant drugs, they can be used in the parenteral form or it can be used in the oral form, just like the heparin, denadipuride and lepuridine. These are the drugs which are used as anticoagulant for the parenteral purpose. Next is the oral anticoagulants. These like warfarin sodium, dicumarol and fenproquinone and acinomercurol and encintium. There are also some other coagulation factors and in which the thrombolytic agents are there, just like streptokinase, urokinase. They are the thrombolytic agents. And there are some antiplatelet agents also, like aspirin and ticlopidine, clopidogrel, one of the drug which we are going to discuss, this antiplatelet agent. Okay, now let's discuss some of the anticoagulant drugs which is in our syllabus. So the first drug in this category is the menadione. This menadione is a 2-methyl-1,4-dihydronaphthalene 1,4-dione. You can see the structure. The compound is belong to a class of organic compound which is known as naphthaquinones. These naphthaquinones, basically they are the naphthahydroquinone moiety, which consist of a benzene ring linearly fused to a benzene 1,4-dione, which is a quinone basically. Benzene 1,4-dione is a quinone. So superclass of this menadione is benzenoid, class is naphthalene and subclass is naphthaquinones. This naphthaquinone is a synthetic naphthaquinone without the isopironide side chain and the biological activity, but it can be converted to the active vitamin K2. There are a number of vitamin K, vitamin K1, K2, K3. So this can be converted to the active form of vitamin K2 after the alkylation, basically after the reaction of alkylation reaction. This menadione is known as the vitamin K3 and it is converted into vitamin K2, which is the menaquinone. The primary function of this vitamin K is to assist the normal clotting of the blood, but it may also play a very important role in the normal bone calcification. This vitamin K3, it is not used as a nutritional supplement. Don't think that like other vitamins K, this vitamin K3 is not used as a nutritional supplement, because it causes some adverse reaction, which is the hemolytic anemia, and in case of the large doses it also reported that it caused the brain damage. Now the next compound is warfarin. This warfarin is 4-hydroxy 3-3-oxo 1-phenylbutyl 2 H chromin 2-one. This compound belongs to a class of organic compound known as 4-hydroxycoumarins. This is the derivative of the coumarins. This coumarin that contain one or more hydroxyl group attached to a carbon 4 position of the coumarin skeleton. Very interesting thing about this warfarin. Warfarin is the name coined after the name of its inventor. The institute from where this warfarin originated, that was the Wisconsin Alumni Research Foundation, WARF, and it is from the coumarin, arin, so that comes from coumarin, arin, and WARF, WARF, Wisconsin Alumni Research Foundation. So that's why it is known as warfarin. So it also very important to share this information that this warfarin is a very dangerous or poisonous for the rat. That's why it's also known as the rat poison. When the rat or animals that ingest the drug in large amount, they start bleeding up to the death. So now this warfarin belongs to a class of superclass of the phenylpropanoid and polyketides. Class is coumarins and derivative. Subclass is hydroxycoumarin. This warfarin is an anticoagulant drug which is normally used to prevent the blood clot formation. Although originally marketed as a pesticide also, this warfarin became the most frequently prescribed oral anticoagulant in many countries. Some of the associated conditions in which the warfarin is used is like the myocardial infarction, pulmonary embolism, stroke, systemic embolism, thromboembolism, thrombosis, and some transient ischemic attacks. This warfarin basically it disrupts the coagulation cascade to reduce the frequency and extent of thrombus formation. During the metabolism, this warfarin is both stereo and radioselective, and the major metabolic pathway is the oxidation, and during the oxidation the hydroxywarfarins forms, number of hydroxywarfarins forms, and these hydroxywarfarins, they are around 80 to 90% of the total metabolites, and they play important roles. Now the next, how can we synthesize the warfarin? Yes, we can easily synthesize the warfarin by using the Michael condensation of the coumarin with the benzyl acetone. This Michael condensation or Michael condensation is of the coumarin with the benzyl acetone. What is this Michael reaction or Michael reaction or the Michael addition? It is the nucleophilic addition of a carbon ion or another nucleophile to an alpha beta unsaturated carbonyl compound. It belongs to a large class of conjugate additions, and this is one of the most useful method for the formation of the carbon-carbon bond. So this is how the warfarin, and the warfarin which form is a racemic mixture. Now the next compound is Encintium. This is 2,4-methoxyphenyl 2,3-dihydro-1H-indene-1,3-dione. This compound, it belongs to a class of organic compound known as indene diones, in which the compound containing an indene ring bearing 2 ketone groups. Now the superclass is benzenoid, class is indene, and the subclass is indenones. Now this Encintium, it is a synthetic anticoagulant. The action of this anticoagulant is mediated through the inhibition of the vitamin K mediated gamma carboxylation, which of the some precursor, which are the precursor proteins, which are very critical in forming the active procoagulation factors, which are in numbers like second factor, seventh factor, ninth factor, 10th factor, and some of the anticoagulant factors also, just like protein C and protein S in the liver. So this Encintium, it mediates through the inhibition of some vitamin mediated gamma carboxylations of the proteins, and these proteins, they are the factors, coagulation and anticoagulation factors. Now the next drug is clopidogrel. This clopidogrel is a compound, belongs to a class of organic compound known as alpha amino acid esters. These are the ester derivative of alpha amino acids. The class is carboxylic acid and derivatives, and subclasses amino acids, peptides, and their analogs. Basically, this clopidogrel is a prodrug of the platelet inhibitor, which is used to reduce the risk of myocardial infarction and stroke. This is indicated to reduce the risk of myocardial infarction for the patient with non-ST elevated acute coronary syndrome. This drug, clopidogrel, is superior to the aspirin because this is an antiplatelet drug. So this is very superior to the aspirin. How? In reducing the cardiovascular outcome in patients, those patients which have the cardiovascular disease. So it's superior than the aspirin. So overall, this clopidogrel is used to reduce the risk of the myocardial infarction and for the which have the acute coronary syndromes. Some of other problems which are associated are the acute coronary syndrome, acute myocardial infarction, and some atherothrombic events. So this is all about the coagulants, and we have emphasized more on anticoagulants. This is about the more on the anticoagulants. Thank you.